Lovely viewers, this is the Health Matters Show. Indeed, your health matters, and I welcome you to today's edition. Remember, the Health Matters Show is powered by Simbet Media. We are live on Facebook, Instagram, YouTube. When you go there, please subscribe to our channel. Share to your friends and loved ones. Let them also get access to everything that is going on here. And please do not forget to click on the notification bell so that whenever we drop a new video, you'll be the first to be notified. I know you wouldn't want to miss any of our educative videos, so please click on that button so that whenever a new video is being updated, you'll be the first to be notified. And also do not forget to comment. This is the Health Matters Show. Last week we were here, we talked a lot about one of our topics. One of our mother was here to teach us. Mama Tryphosia Peterson, she was here. We looked at breast cancer, yes. Mijidie pasi esuade na ye mama ekuku dembi wa hapa ono so ene obeboae ama ye topic e bebe suen ho ade no yatimi a ebubu mu na ye suade papa ansa na meda ye mama ye di na ye topic no ye betwa ho kakra na ye ba e di atoa so. All right, viewers, you are welcome from that short break. As I said earlier, this is the Health Matters Show. And today too, we said your health matters a lot. So we are bringing your way a very nice and educative topic, as we always do, powered by Simbet Media, always bringing you the best. Today we want to look at a very important topic. It's something that most of the time we don't have much idea about. But today, we are going to learn a lot about it. And your own host for today's program is your sister Mary Kwashi. The topic we are going to discuss today is understanding the importance of surgery and its implication on our health when ignored or delayed. Yes. Ebi a yesi oye surgery na bibi nti o delay anase when you adwen free so kran pese ehwe dia ehu hia eni insusuanso boni e de beba ye health so a abra ye mpese e be anase ye yi adwen efri so kran se doctor this asem ni bi etu enima nti ene me nko bebia se de me di kan no bomodi aneti na we guane so. Now our guest for today, I said earlier, who is going to help us to digest our topic, understanding the importance of surgery and its implication on health when ignored or delayed, is our own mother, Mrs. Augustina OFOSU NKRUMAH. She's a senior or she's a nurse at a Chicago government hospital. At the peri-operative nurse, yes, that's where she specializes. So when you go to a Chicago government hospital, our mama is there. She will be there to guide you, very good person. She's also a deaconess in the Church of Pentecost. She fellowship at the Efiekuma DYA Memorial Temple. Mommy, you are welcome to our show.
Thank you.
Our viewers are so excited, as I am here, to welcome you to our show today. We know that as you always come, you always give us the best. So we believe that today we are going to learn. Viewers, our mama is ready. But before we go on with our topic, I would like to thank our sponsors who is always helping us. If you see how I'm neatly and nicely dressed before you, it's a kind gesture of Sandy Style Collection. Sandy Style Collection. When you go to Fijai Junction, she's there. Anything you want about dress, you want to go for a party, a wedding, and you want something beautiful to put on, please go to Sandy Style Collection. I'll put her number across if you want to call her. Her number is 053-1275-449. 053-1275-449. When you go to Instagram, it is Sandy's Closet. She's there. So whenever you want anything about dress, please contact her and she got you covered. All right, so we'll go straight to our topic. Mami, you are welcome once again.
Thank you.
You said the Eddie Kain. You see a share surgery. We move ya tu need yankasi ya man need operation. But na person share it's important and implications e bi e de beba. Wa kona doctor atofo say we surgery but e dey see enye. E bi o ho ehu ni adenti. E na wa beji de say e be sua de pa. Nti ansa na e be to as e person share ka medically e ka surgery. But what does the term surgery mean medically?
Okay. So before I start, no maminchia papa pastor Tetelati, our Efiekuma district pastor. Any my presiding elder Benjamin Aji, any my former presiding elder Ekowasma, and Mama Erica. Any all our viewers.
Yes, yes.
We greet you. So when we say surgery, surgery is a branch of medicine.
Okay.
Yes, that comprises preoperative, intraoperative,
Okay.
and postoperative care of a patient or a client. So when we say surgery, that is it.
That's what surgery means.
Yes.
It's broad. Emma me
Yes.
waka. Me mama musuro kwa itefo. Obe pepe nyi na mu amaye. Nti ye hwe say the waka no. Ye gidi ye pass medical ni surgery ya de ehu hia, it's important. But in prepare bi oho we some people, let me put it like that, some of us we don't take it be as important because bi oho ehu ni bibi reasons known to them. Nti be say hwe how important is it on our health? When we ignore it and as a delay, but how is it important to us? And who here pass you catch us say surgery, you say we in temper now.
Okay. So surgery no ehia
Okay.
it's an senya bibia na medical e draw to me treaty. Yes, sometimes you have to undergo a surgery to either alleviate pain, to restore function, or to cure a disease.
Okay.
So it is crucial to our life. Surgery is crucial to our life. Yes. And so say if you are call hospital now, say you have to undergo a surgery. You don't have to ignore or delay. Because the more you ignore, the more you delay, no, the more whatever is going on progresses.
Okay.
Nti emfa say bia or diabetic foot. Yes, you toe no, it has affected your toe. Yes, you toe na we say if you and yes I be didi akọ, we say through surgery. So you go to your house, you forget about the surgery because you are afraid. Later on when you come back, you see that the whole foot will be affected. And instead of taking the toe now, the whole foot will have to be amputated. And if you don't take care, the longer you keep in delaying, the much further the condition progresses. Until sometimes you can stay for as much as you want. By the time you come, you know that it might spread from the foot to even the knee level. Yeah. So instead of the toe, you might either lose your whole foot or even your leg.
Okay.
Yes.
Mommy, thank you so much. Into this one, yaka surgery. But in prepare surgery, people call it operation. And so we say you be surgery, and I assume some style be into operation. They are no I say why relieved. So we want to look at is there any difference between the word operation and surgery? Per se it say one fine say difference from some patcho. Boy na
surgery and operation are used interchangeably in our daily language. Yes. Even when you come to the medical field, we use it interchangeably. So, but when we say surgery, I would say surgery is the art, the broader field. Yes, the art of using a manual or instrumental or instruments. Yes, to treat a condition. And then the operation, no, sayaka is the act. Yes, of performing the surgery. That is what I will say. But actually, we use it interchangeably. So, maybe let me call you operation. I'm going for an operation. I'm going for a surgery. Yes, we use it together.
Wow. It's information. Is that the mamia cano? Operation is surgery. Yes, it's a work operation. No, I say procedure. And a surgery near broad. Are there any types? Do you have types of surgeries? Maybe we will always who or be any need in temperature. My own types are ewo.
So actually we have major and minor surgeries.
Okay.
Yes. And when we say major surgeries, they are the invasive surgeries that will go deeper into the body cavities. And then the minor surgeries are the superficial ones.
Okay.
So the major surgeries, some like the myomectomies, appendectomies, when you go deep into the body. And then we have the superficial ones like tooth extraction.
Okay.
Yes, it's a minor surgery. Cataract removal is a minor surgery. So that is the difference. We have a major and minor surgeries. And when we delve deeper, we also can say that We have surgery according to purpose,
Okay.
surgery according to agency, according to the technique or the specialty.
All right.
So when we take the purpose, we have cosmetic purpose, we have the diagnostic purpose, the curative purpose, the palliative purpose, the transplant purpose. And people say you're kidney transplant, heart transplant. People say you're cosmetically, or toninofo. And sometimes to diagnose a particular condition. Yes. And palliative no to support you at the prayer no. It cannot be cured, but through the surgery you might be able to extend the
yes, Kaka.
yes,
Okay.
yes,
Okay.
yes. And then when we come to agency, yes, that one we have the elective, we have the urgent and the emergency. So elective ones are the planned ones. You discuss with your doctor, you are going to have a surgery. So on this day, you come to the hospital, you are booked, then yes. And then the urgent one, you need it maybe within 24 hours or something. Okay. Yes, it's urgent. And when we say emergency, immediately. Something has to be done now. Or you lose your patient or something might happen.
Okay.
Yes. And then according to technique too, we have the open and minimally invasive surgeries. So the open is where we cut or they cut into you. Yes. And we do what we have to do. And then the minimally invasive, it requires some incisions.
Okay.
They give you some small cuts. Yes. And with that, they use flexible scopes. We have what we use for such, operations. And it's done, you can see it on the screen.
All right.
Yes. Everything is done inside, but you see it on the screen. So when you are going the wrong way, anything, you are directed by it. Yes.
Okay.
Yes. And then we have the, that is the robotics. Yes, or the laparoscopic. And then we have the lasers and the endoscopes. Yes, they are also types of surgery. Yes, the techniques of surgery. And then, according to specialties, we have the plastic surgeries. We have the orthopedic surgeries, those who deal with bones. We have the ophthalmic surgeries, those who deal with the eye surgeries. Yes, neurosurgeries and all that. So many of them.
Thank you. So, per all the types you have said, I think there's someone still out there. Nipa no ye ka surgery. I just no person obeti. Are there any misconceptions about surgery in general that you like to clear? Into a clear no so that other people also have free mind. Ye ka operation ebe to me dey akuma pa akwa into misconceptions about surgery.
So you see, in the olden days, we learned that the surgeries were done without any anesthesia.
Okay.
Until maybe you are going to for a CS. Yeah, more anesthesia biao. So they just cut you. Yes, you have to endure.
Wow.
So they used to endure pain during surgeries. And because of that, and that perception has been there, and it's being transferred from generation to. So some people in this age, right, they think that it is painful. You see, and some will say that when you undergo a surgery, or when a knife cuts you in the operating room, you don't become normal again. The operation, you are not normal again. Some too will say that the fear. In fact, most of it is a fear. The fear of the unknown. If you could say anesthesia not man is dangerous, it can kill you. It's what man done and sorry be me. You see, so these are some of the misconceptions about surgery. It deters people from undergoing surgery.
Wow. It's haven't cleared this misconception. Obi or maybe a fear no ho. On person the oka say be say the kind call you don't become normal again. It's no you were in Ruby or why the man in Pana. I see if see a clear side no. Na obia akuma timetoni yem. Say bia ye ka operation say the nyina ye can access surgery. In patcho anesthesia na we can patcho dear me person etiase. What does it really involve?
When we say anesthesia na the medications, the gases that are given to the patient before the surgery even starts or the operation even starts. So when you come to the theater or the operating room, we have 3 groups that work to perform an operation. So we have the anesthetist, we have the preoperative nurses, and then we have the surgeons or the doctors. Yes. So the anesthetist, they give the anesthesia. And the anesthesia is supposed to make you undergo the surgery without feeling any pain, being stressed about what you are going through and anything. So today, cry, you can have your surgery, be on the table, you'll be conversing with the anesthetist. Yes, asking any question you want, laughing and all that. It's because of anesthesia. Yes. And now we have safer pain medications. Yes. So gone are the days when you say that after operation you'll be in so much pain. No. Now, because of anesthesia and better pain management, a surgery operation is not so painful and fearful again.
Thank you, my viewers. In fact, we are learning. I share so, but a higher day. We are looking at understanding the importance of surgery and its implications when delayed or ignored. The implications it brings on our health when we delay it. So you've gone to the hospital, a doctor have advised you that, oh, what is going on in your body or you need what, a surgery. Please, we have cleared some misconceptions. Gone are the days that surgery was so painful. But no matter what, when the doctor advises, please let's comply and undergo, because they have a lot of things in place that will help you to undergo it safely. Remember, this is a Health Matters show, and indeed your health matters. It is powered by Simbet Media. When you come to NKRUMAH or BU Ridge, Simbet Media is there. What do you want about media? Is there a song ministration? You want to record your songs? Anything about media, live streaming? Simbet Media got you covered. You go to Facebook, you go to YouTube, Instagram, search for Simbet Media. Our informations are there. And when you get in touch, anything about media, live recording, streaming, everything, Simbet Media got you covered. Remember, this is Health Matters show. Indeed, your health matters. We'll go on a short break, then we come back. All right, you are welcome back from that short break. Remember, this is the Health Matters show. When you go to all our social media platforms, it is the Health Matters show GH, Health Matters GH, YouTube, Facebook, Instagram, Twitter. Please subscribe to our channel. Share to your friends and loved ones. This is the Health Matters show, and we say indeed your health matters. Our guest, as I introduced earlier, is our own mommy, Augustina OFOSU NKRUMAH. She's the one helping us today to look at our topic. She has started already in the places. In fact, I'm learning. Please also do learn. Let's unlearn to relearn. Our topic for discussion is understanding the importance of surgery and its implications on health when delayed or ignored. Inti mpacho se yedi kanya kanu. Surgery nenye hu. Inti misconception na ewo yetim no. Yenyi nyina mfi ho. Na se akwanya ba na ehu hia se undergo surgery a yakwa ma na efe. Esa se omu de nyama bebrebe to akwan ma emma enye hu kran. Inti me nko bebi ya to aso. Mommy, we want to continue. Having looked at what surgery is, the difference between it and operation, and then some misconceptions. So maybe now I've cleared all my misconceptions. I've agreed that, oh, I'll not be afraid again. The fear is gone. So I want to undergo the surgery as the doctor has advised. So what are some of the points I need to consider before even going and undergoing the surgery? So let's look at some of the points to consider before undergoing surgery.
So some factors to consider before surgery. So on the part of the client will be that you have enough financial support. Maybe your insurance and your own financial support. And then support from persons. Yes, those who will help you after surgery, when you need to do your chores and other things. Yes. So support persons, you have to consider it. You have to consider your health. Yes. You have to be fit for surgery. So you have to eat well, you have to exercise well. And then if you are giving medications or something to take before the surgery. You have to take it seriously. Make sure you complete it. Yes. And then maybe understand the condition, the operation that you are coming to.
Okay.
Yes, you are undergoing. Understand it. Know the risk. Know the goals of the operation, and know the recovery time, so that you can plan well. Every operation has risk, but then, as we said, in this our modern world, things have been put in place to curb those risks, unlike before. And on the part of the healthcare providers, the surgeons or the nurses, yes, and the rest, you undergo some labs, you take some labs for them to know your health status, your HB, if it is good, whether you have any condition or something, yes, all those things. And then your medical history, we have to know whether you have allergies or you are treating any chronic condition. Yes, we have to take all that into consideration. You have to know. And then in anything that we might need to
do.
Yes, so that we prevent complications. Yes, so we take everything seriously, from health history, family history, everything. Yes.
So please, does it mean that the points to consider, maybe like you said, the health service providers must go under some tests and all that?
You, the client, you'll be made to undergo tests.
Okay.
Yes. So we know your HB. You have enough blood for the surgery. Like something like myomectomy, fibroid surgery. Yes. Already you are bleeding. That's why you even come. Those who are not bleeding don't come. And then you are going intra-op. When you are cut, you will definitely bleed. So we have to make sure that your blood is at a certain level. Yes. And then you secure blood. You have to take all that into consideration. Yes. People who come and donate for you and all that.
So even when you have some particular things that you look at, so even if one is not in place, the patient will not be allowed to undergo the surgery. For instance, the person should be in good health. So even if the person is not in good health, you have to hold on.
Yes, the anesthetist might suspend the surgery. Because, for instance, if you are coming for a surgery and you have a respiratory tract infection, you see, you have to be given anesthesia. And sometimes with the anesthesia, maybe you have a respiratory distress or something that they have to intervene. But because already you have a respiratory tract infection, it will interfere with what they have to do for you. So you have to treat it before you come. Or any condition that might interfere with the anesthesia or any of the things we are going to, you have to be treated before you go for the operation.
Thank you so much. Before we continue, you said something earlier that the types of surgeries, you said we have planned ones and we have some that the doctor will advise you to do. So I want to ask, it means that the surgery that some people are even afraid of, some people come willingly. Some people come willingly that, I want to undergo this surgery.
Yes.
So which type of surgeries do they come willingly like that, she me, obi sure no she me, but person surgery?
Yes. So for instance, someone wants to give birth. The person hasn't given birth before. But fibroids are worrying the person. It has to be removed. You come willingly for it to be removed so that you can conceive. Sometimes the older women, you see, because of their age, maybe your bleeding issues, the person will not give birth again. So they will come that they should do hysterectomy for them. They should remove their womb for them so that they bleed. And even with the fibroid, because sometimes fibroid, some come and they said they don't want to remove the nodules. They should just remove the womb for them so that they will be free. So sometimes some people come on their own free will. Yes. Maybe the person will go to the hospital. This is your problem. You have to do it. So with the information the person has, I don't need the uterus again. I'm okay. Yes, this thing is worrying me. I'm okay. Let's do it. Okay. And so sometimes you see, the information might not be there. The person might not be privy to the needed information. And that is sometimes what makes people too afraid to go for surgeries. Yes. But I think if They understand what the surgery is about, what is supposed to help them achieve, and other things are the risk involved, how it can be minimized, and the care that is going to be given to them, how it is going to help them. I think they will willingly and freely, yes, come and do it.
So all those with the buttocks, flat tummy and all that, they all come willingly.
They go willingly.
So
they even pay much money.
Okay.
Yes.
Wow. So that's nice. In fact, we are really learning. Surgery. And willingly to go and do it. So please, when the doctor advises, let's go and undergo all the informations. Let's look at it, and then I believe that they will help us and everything will be successful. Okay, so Madam Nurse, now the patient has come. You've sent the person through all the information he or she has to know. So I'm now ready. I've gone through the surgery and I'm done. Please, what are some of the things that that patient needs to put in place in order for a successful healing process? And some of the factors are considered before going into it. Into surgery, they are very Nyama ben SSR patients in order to acquire and confer complications behind babio.
And something like the support person that you plan before the surgery will be needed after the surgery. Yes, they will be there to help you out so that you can rest enough to recover. And then after surgery, you are advised most of the surgeries, especially the invasive ones. Yes, we don't want the surgical site to be infected, so it's not supposed to be wet. You have to keep it dry. So most of the times, for some weeks, you have to be cleaning yourself. You can't go under the shower like you normally take your bath. Okay, so yes, you have to clean yourself with maybe a towel, a clean towel, soap, and all that, so that you don't get your wound infected, your surgical wound infected. And then your medications. During the operations, you'll be given injectables, but after the operation, you'll be given oral medications. You have to make sure that you complete the oral medications that you are given. Sometimes someone will say, oh, I'm okay. After undergoing the surgery, I don't feel the pain again. The problem has been solved, so I'm okay. After 1, 2, 3 days of the medication, they will just stop. No, you have to complete your medication. Yes, for proper healing. And then you have to be active. You don't have to always be in bed. Yes, like you said, you'll be given proper pain medications. Yes, so you have to be active so that your circulation is improved, your healing is faster, and then you yourself, you will feel well early. And then after the surgery, anything that might come up, you don't have to sit in your house. You have to come to the hospital, let them know, so that early intervention can be given. Yes, yes.
Okay, so please, there is this, I don't know whether it's a misconception that people also, we've cleared it, but sometimes they say that after surgery, nipa no bet no weka so me dey me operation nti ade kra me maso so be the bucket and so ko say jare. So with that one, you said we should be active. So please, that doesn't mean say nipa ni operation and I say surgery. I say nyame kakra and bi o we so ye. You have to do some of physical activities, or the person should just rest, relax, so that don't do anything. Please, is it possible like that?
So we are not saying that you should rest in bed, not to do anything. No. And we are not saying that because you should resume activities, you have to go and carry things and carrying buckets. No. We have some surgeries that when you undergo, you can't be lifting things like you used to. Something like hernia. You see, the abdominal wall is weakened. And so what is inside you is coming through that weakened area and it's bulging somewhere. Hernia, no. So after undergoing the surgery, you can, especially those who do the concrete work and those, yes, they usually come with those hernias. So if you undergo a surgery, don't expect you to go back and carry no. Maybe even if after everything you have recovered well, when you go to the site, you can resort to doing something else. Not necessarily going to carry the concrete, and you can be mixing for somebody to carry and all that. Yes, do something. You can resume your normal work, but then you have to be careful.
Okay.
You have to be careful. And it's something like CS2. You see, a baby has been taken out of you, you have been cut. So for some time, you need to heal both inside and outside. With the outside nipple there, sometimes 1 week, 2 weeks, it's gone. Yes, but the inside healing, it takes time. You have to give it time. But that doesn't mean you have to be in bed. No, you can go about you can cook, you can clean, you can wash. That's maybe some strenuous activities are what we advise you against for some time, so that you fully get healed before you can involve yourself in
So having cleared this, it means that by all means, after the surgery, a period will come that the person will gain back his or her health in normal terms.
Yes.
You can go back to other activities that you used to do normally.
Yes.
And everything will be okay.
Yes.
Wow. Lovely viewers, this is the Health Matters Show. Please, we are learning a lot. The fear of surgery. Please, our mommy has taught us a lot today. Let us clear those doubts and fear. The misconceptions that we've built in our mind, please, she has cleared everything for us. When you're advised to undergo a surgery, it's because they have placed some things in order. There are things that are there, informations are there. They will take you through a lot of procedures for a successful surgery. So please, we shouldn't be afraid. Some people even go willingly. Yes, some of our sisters and brothers with their own way of going for a surgery. So please, we shouldn't be afraid. Let's clear all those misconceptions so that our health will be restored whenever the need arises, because the health matters. Should we say that indeed your health really matters? Very soon we'll be bringing our show to an end. But before we go, we'd like to ask our mommy another question so that she will clear that also for us before we take our show to the end. So please, mommy, we are looking at understanding the importance of surgery. The topic I share, and then the implications it brings when it is being delayed and ignored. So we want to look at some of the implications when our surgeries are being ignored or delayed. What implication do they have on our health?
Okay, before I come to that, let me say, someone will say that they said you can go back to your normal activity. Here is the case. My leg is amputated, my arm is amputated. You are telling me I can go back to my normal activity. Maybe the person is a market woman. The leg is amputated or the foot is, how does she go back to her normal? So with this, before the surgery, you made known that after this is what is going to happen. So sometimes some are given prosthesis. Yes, like the arm, the leg, something to, but sometimes it's expensive, so not everyone is able to, and sometimes too, when you come to the hospital, we teach you certain things that you can. For instance, if you can't afford the prosthesis, but you can afford a wheelchair or something, you can still go about your daily work. Okay. So there are options, but when you come, that is when you get to know. Unless you come, you don't know. Yes. So when you are to go for any surgery, let them explain to you everything that it involves. Everything, whatever is there for you to know
about it.
Yes, know it. Then you make your decision. So when you delay or you ignore the advice to undergo a surgery, in fact, as it progresses, it can even end your life.
Wow.
Yes. It can give you a temporal deformity.
Okay.
Yes, some of the conditions. It can impair your function.
Wow.
You see. So as much as possible, we should try to get the information we need, make an informed decision, and then try and help ourselves, because surgery is now crucial to our life. Sometimes it's not anything that medication can eradicate or treat. You have to undergo surgery. Yes, so it's important that you understand what you are going to do, know everything there is to know about it, and then go for it. Yes, go for it.
Okay, so someone is asking that you are going to have a surgery, and with the information that are being made available, maybe you are not supposed to eat or drink water within the period. Is there a misconception, or actually is there, and what reason is behind it? That before you undergo a surgery, you shouldn't take in anything, either liquid or solid. You shouldn't take in anything before you undergo that surgery. Is there any reason behind it?
Okay, so when you are going for a surgery, the night before the surgery, you are told not to eat or drink anything. That is to free your bowel.
Oh, all right.
Yes, we want your bowel to be empty, so that in case the anesthesia, anything goes wrong, they can intervene.
Okay.
But if it is you've eaten or you've taken water or juice or anything, it can even interfere with the anesthesia they are giving you.
Wow.
Yes, you can aspirate, anything can happen.
Okay.
So we want a free bowel. We don't want any complications. You see, that's why we asked the patient or the client not to eat or drink anything. So, and in so doing, you know, you will be given infusions, fluids, to sustain you.
All right.
So you might not feel too hungry. Yes. You'll be given infusions to sustain you from getting hungry.
Okay.
And after the surgery, if it is not an invasive surgery, after some hours, you can resume your sips of water. Yes, your drink or something. But if it is invasive, maybe your intestines and other things were touched, yes, then it will take a longer time. But it can even, sometimes can even be the same day or two for you to start sips. Sometimes you have to, your bowel sound will have to, and then your bowel is working. Yes, before you start sips. Because if that doesn't happen, it brings about certain complications. And we are saying that now the surgery is safe. We want to prevent all complications. Yes. So that is some of the rationale, the rationale behind you not eating or drinking before surgery. It doesn't, so that it doesn't have to, it doesn't have any complications with anesthesia will be given. Okay. And for you yourself to suffer, or for the anesthetist to have a difficult surgery, you see.
Okay. In impartial, with the information that are being made available for the patients, you made mention that you have to sign something or a consent form or something. So a situation where maybe it's an emergency and maybe there's no family member available, and the person let me say the person is in coma, and you need to immediately undergo the surgery. Is there any intervention the medical practitioners have to put in place? Because the person will not be able to sign. So medically, what do we do? Or we still need to go and look for?
No.
Okay.
So in that case, the surgery will be carried out.
Oh, wow.
If that is what is needed to save your life, it will be carried out. But whereby it is an emergency, but the patient is conscious, yes, a consent will be sought, either from the patient or the relative who is available. That is if the patient is conscious but still cannot sign anything or thumbprint anything, the relative can do that for the patient. But where the patient is sound, conscious, and can give the consent quickly, everything is being done to get the patient in. So quickly, you fill everything, you give it to the patient to sign, to give a consent. So that the patient will not come back and tell you that I did not ask you to do this. Or yes, I was forced into no. Yes. And before you even sign the consent form, you will be taking through whatever you need to know for you to understand before you consent to the surgery. You don't just be given a seat to sign. No. You have to understand everything before you sign for the surgery.
Interesting. So surgery, say that everywhere can operation is very, let me say, safe, especially with this era in which we are. It is safe. We have a lot of modernized machines that we are using to carry out this surgery. Indeed, your health matters. Our lovely viewers, we don't want anything to happen to you. We always want you to be around, to learn for us, and also stay in good health. That is why all this information is available to us. So you go to Instagram, TikTok, YouTube, Facebook. It is a Health Matters Show, GH. Please, Health Matters, GH. You subscribe to our channel, click on the notification bell, share to your friends and loved ones. Very soon, we're bringing our session to an end. I believe you have learned a lot. Your health matters. So please, we shouldn't take things for granted. When the doctor advised, let's also do our part by complying. Going to them, take the necessary advice that we need, and we believe that everything will be successfully done for us to gain our health. We don't want any complications and implications on our health. We want all of us to be in good health. So health matters, we say that indeed your health matters. As you have seen me beautifully dressed with you here today, it is our own sister, Sunday Style Collection. Yes, she has adorned me beautifully this time that I'm here with you. So anything that you want in terms of clothes, you are going for any program, any function at all, just go to Sunday Style Collection and she got you covered in any way. I'll put her number across so that when you want to contact her for any of your clothes, bags, shoes or anything, Sunday Style Collection is there to help you out. Her number is 053 1275 449. 053 1275 449. That is Sunday Style Collection. When you go to TikTok or Instagram, it is Sunday's Closet 24. Sunday's Closet 24. Your health matters indeed. We are powered by Simbet Media. Yes, anything about media. You want live streaming, song recording, anything at all you want about media, please contact Simbet Media. They will do everything for you nicely at a cool price. Simbet Media, we got you covered about everything media. At this time, we are almost coming to the end. But before we go, we'll go to our mommy, our own nurse, who has taught us a lot today. Mama Augustina, OFOSU NKRUMAH. We'll take her last word and advice she has for us. I always say it and I'll continue to say it. Those last words, don't miss them. Always put them, hide them somewhere, jot them down, because one day it will help you. So, Mommy, before we go, our viewers would like to hear your last word. What advice do you have for us about all that we have talked about today? Any advice for us, please?
So I will say that by the grace of God, in this era, surgery is not as fearful and as risky as it used to be some time ago.
All right.
So anyone who needs to undergo surgery, just be informed. Know what you are going to do, understand what you are going to do, know the risk involved, weigh it out, know your recovery time, be informed. Be informed. And when you are informed, you see that you have no cause to worry. Yes. And make sure to go for the surgery and it will be well with you.
Make sure you go for the surgery and it will be well with you, just as it will be well with our soul. Amen. Mommy, thank you so much. In fact, today, me myself have learned, and I believe my viewers have also learned a lot about surgery. In fact, we had a lot of misconceptions, but today you've cleared our doubts. You've made it so easy for us. We'd like to use this opportunity to say a very big thank you. We are so much grateful for honoring our invitation to come and teach us. We'll be calling you more often because we want to hear more of your teachings. God bless you so much. Viewers, we are almost coming to the end. Your own sister, Mary Kwashi, is your host for today. Remember, this is the Health Matters Show, and your health always matters. Please do not sit down. Remember to go and undergo the surgery. Take care of your health. Remember, you are what you eat. Okay, you are what you eat. So take care of yourself. When the advice comes that you need to go, please do not be afraid. Even the Bible said that we shouldn't be afraid, we shouldn't fear. Just go and be informed and undergo the surgery, and it will be well with us. Until next time, have a good time. Bye.